Hello everyone. Today we will be updating some of the important clinical research on the Ayurvedic herb Gymnema, which is mainly used for insulin resistance and type 2 diabetes. So, looking at our topics, I will start with giving you a general overview because maybe this herb is not that familiar to some of you. Then we'll look at the metabolic effects in part 1, both of those in part 1. And then in part 2, we'll have a look at its effect on sweet perception and resultant behavioral changes in terms of eating patterns that can result from that. So beginning with our overview, its botanical name is Gymnema sylvestre. We use the leaf. Its common name is Gurma in Hindi, which is a sugar destroyer, and that reflects on its capacity that when tasted, it anesthetizes the sweet taste. So it's a wonderful party trick you can try out with your friends. I've done it several times. It makes my favorite thing, chocolate, not such a wonderful experience. Its key actions are anti-diabetic, hypoglycemic, weight reducing, and cholesterol reducing, and we'll be looking at all of these aspects in the clinical research. And so you're going to use it in type 2 diabetes, but even perhaps in type 1 diabetes, because there was an early trial that suggested it helped restore beta cell function in patients with type 1, the autoimmune type of diabetes. You can use it to reduce the sense of taste for sweet foods and hence alter eating behaviors and appetite regulation and weight loss. Also, we should add metabolic syndrome and insulin resistance there. In terms of safety, we don't have any contraindications for it, no warnings, precautions. It's probably okay to use in pregnancy and lactation. Certainly no adverse effects have been suggested. It will certainly add to the effects of certain anti-diabetic drugs, so you do need to be careful in that context. And as you'll see soon, it's a saponin-containing herb. So as with all saponin-containing herbs, it may cause gastric irritation and reflux. So often the way to do that is to have it with food if you've got a sensitive patient to minimize that reaction. So, as already mentioned, the key constituents of Gymnema are saponins. Now there are two types. They can be acylated glycosides, and they're called the gymnemic acids, or they can be non-acylated glycosides, and they're called the Gymnema saponins. So this is the acylation that is being referred to, and hence the structure we're showing here is a gymnemic acid. These, together with the peptide gumarin, are thought to be the anti-sweet principles. So looking at recent trials, let's start with, well, there's actually 3 trials all out of Mexico, 2 by the same group and 1 by a different group. So if we look at the 2 by the same group, the first was a double-blind randomized controlled trial of Gymnema, 600 milligrams a day, and it looks like they were using a concentrated extract. So that's not a leaf dose, that's a concentrated extract dose on metabolic syndrome. Even though it's an extract dose, it's probably lower than what I use therapeutically, which is 800 to 1200 milligrams a day of quite a strong extract. It's like a 10-to-1 extract. So in terms of the original starting herb, I'm giving 8 to 12 grams a day, typically. So after Gymnema administration, body weight went down quite a bit compared to baseline, and BMI also correspondingly went down. Very low density lipoprotein levels were also reduced, but insulin secretion and insulin sensitivity were not altered. So at this lower dose, there were positive changes in body weight and BMI and one lipid measure in people with metabolic syndrome, but insulin resistance didn't change, which is quite surprising given when you look at the other research, even the research that was done by the same group that's coming up next. So this was a glycemic control trial, and this was a double-blind randomized control trial of 30 participants, same dose, same extract, and they were patients with impaired glucose tolerance, and it was done over 12 weeks. And there was a significant improvement in the 2-hour oral glucose tolerance test. The blood sugar peak dropped from 9.1 to 7.8, and those units are millimoles per litre. And also over the 12 weeks, the HbA1c measurement went from 5.8% down to 5.4%. And about half of the people in the trial had achieved normal levels by the study conclusion. There were also reductions in body weight, BMI, and low density lipoprotein cholesterol levels. So in people with impaired glucose tolerance, this trial, by the same group as previous, showed patients were benefited by Gymnema, probably because it increased insulin sensitivity and you had corresponding improvements in body weight and so on, and lipid profile. So the only reason I can put forward why there were some differences in the two trial outcomes, given that it was the same product and the same group, is that you're looking at different people, and different people respond differently, as you might expect. But I think to lock in all of these benefits, I would certainly recommend that you dose a bit higher than 600 milligrams of extract a day, as already discussed. Now, there was an interesting comparison between berberine and Gymnema, because berberine, which we can get from several herbs, including berberis or barberry species, or phellodendron or Coptis chinensis, berberine and Gymnema are both used for lipid control and blood sugar control, and indeed have positive impacts on body weight and metabolism. So how did they compare? So again, a Mexican study, but by a different research group. 50 people, a comparative study, and they were obese. The average BMI for the cohort was well above 30. And again, they weren't given that much Gymnema. It was just 400 milligrams and only once a day before breakfast, compared to a decent, robust dose of berberine, higher than I tend to use clinically, of 500 milligrams 3 times a day. And the trial was conducted over 3 months. And berberine significantly decreased body weight, you expect that at that dose, blood pressure, and adipokine gene expression related to metabolic risk. And in contrast, the Gymnema decreased fasting glucose and resistant gene expression, which, as the name implies, is related to insulin resistance. So different effects, but partly, I think, induced by one herb, the Gymnema, being dosed at the lower end, and of course the phytochemical berberine being dosed very much at the highest end. So let's now look at meta-analyses, or one particular meta-analysis of 10 studies of 400 people on GS, Gymnema sylvestre. And what did we find? Significant reductions in fasting blood glucose, postprandial blood glucose, glycated hemoglobin, HbA1c, triglycerides, and total cholesterol. Now, all of these effects, as you can see, were not huge effects, but don't forget, over a meta-analysis, you're averaging over different types of products and different dosage regimes, and indeed different patients. So the fact that it did actually show significant improvements across 10 trials is important, and so we should ignore that, or not so much ignore, but take that into consideration when we look at the effects sizes were relatively small on these parameters, and in fact, again, I think if you dose more at the higher end that I've been describing, the effect sizes won't be small. So looking at the specific results of meta-analysis, we can see with type 2 diabetes, the diamond, which is the pooled result for fasting blood sugar, was quite significant over a range of trials over, nearly 30 years. Similarly, fewer trials in this case, but postprandial or after meal blood glucose, again, quite a good clearance of the no effect line. So definitely a very significant result. And if we look at HbA1c, a few trials just showing modest effects and one earlier trial showing a great big effect. But again, as I said, I think it can come back to dosage. And finally, from that meta-analysis, if we look at triglycerides and total cholesterol levels, both significantly reduced. Now, there is another meta-analysis that was done on cardiovascular risk factors per se, and this looked at the 6 studies. And all studies were conducted in adults and had used Gymnema for more than a week and assessed selected cardiovascular risk factors. And the outcomes from this meta-analysis, and no doubt the trials that were used in it were similar to the ones, if not the same, as the previous meta-analysis, although they selected fewer trials. And it shows that Gymnema significantly decreases triglycerides, total cholesterol, LDL cholesterol, fasting blood glucose, and indeed in this one, diastolic blood pressure. So clinically, very similar results to berberine, especially when you look at the lipid side as well. But contrasting berberine, which does improve body weight, no effect was seen on BMI or body weight, although that has been shown in some trials. So we have this question, well, does Gymnema affect body weight and indeed eating patterns and appetite? I'm going to deal with that in part 2, because I believe it does, despite what this particular meta-analysis showed. And I think the reason why it didn't show it is it's all about patient cohorts, but I think especially dosing. So I'm going to do something I don't normally do in a clinical update, and that's look at an animal study. So in this study, mice were fed either a controlled diet, which was a normal diet, you can see this down here, or a high-fat diet, and then Gymnema was given in both cases. Now, the really interesting finding is that for the control diet, you see over here, adding Gymnema had no, we're looking here at body weight, adding Gymnema had no significant effect on body weight. But if we look at those given the high-fat diet, adding Gymnema significantly reduced body weight. So I've highlighted that for you. But also, if you look over here, food intake was the same. Huh? How can that be? So these mice given Gymnema and the high-fat diet ate the same amount of food, but they didn't gain as much body weight as the mice on the high-fat diet alone. So that is a fascinating finding. What does it mean? It means that Gymnema could affect metabolism in a favourable way, so you're burning up the fat more, or it could mean because of the high saponins, some of the fat is not being absorbed and is being passed through. But whatever the case, this could be the context in which Gymnema works really well on body weight, and that is in a diet that tends to be higher in fat. But anyway, more on appetite regulation, body weight, and so on in part 2. So thank you, and we'll meet again soon.